Good morning, everybody, and welcome to National Able Network's Equity Barriers in the Workforce System session. This session is about an hour. We're going to spend the first 30-40 minutes talking about our journey and then have opportunity for questions. Obviously, you can't talk about everything related to equity in 1 hour, but we thought this would be a good starting point to talk about particularly equity barriers in the workforce system, and then begin a conversation, hear some thoughts about those of you that want to share any of your issues or concerns that you've worked with, particularly throughout the pandemic, and then continue the conversation in the weeks and months to come as we have lots of opportunities to improve equity in the workforce system. So I will kick things off. A little bit about National Able Network. So we've been around over 40 years, really helping make careers happen for the people that we work with. We serve thousands of people every year and really work with them on overcoming barriers to whatever they need to get back into sustainable family sustaining jobs. And one of the things that I think is interesting about ABLE is that we work in, I like to call it all the acronyms: CSEP, WIOA, TRADE, HVRP. Everyone on this in this group probably knows the various acronyms related to the federal workforce system. But in addition to that, we have had the opportunity to provide innovative public-private partnership programs. Our veterans program, our IT training program, and our senior program that provides digital divide support to seniors in Illinois. So it gives us an opportunity to be innovative and to have an opportunity to think about the workforce system outside of some of the restrictions that you get with public dollars. And so I think as a result, we have a little bit of flexibility around how we work and move within the workforce system. And that's provided us an opportunity to think about equity in different ways. I'm going to introduce our speakers for today. Obviously, I'm Bridget. I'm the CEO of National Able Network. Matt, you want to introduce yourself?
Thanks, Bridget. I'm Matt Weiss, the president of National Able Network. Been here for about 8 years, and I'm looking forward to talking about our equity journey with everybody. Autumn?
Autumn Dawkins. I am Senior Director of Workforce Equity, and I also run our CSEP program here at ABLE. And I am so excited to share with you all the great work we have been doing as a team.
Wonderful. Thank you so much. Our purpose today is to share our journey as well as our mistakes. We want people to learn from our mistakes as we've been on this journey as an organization. I also want to highlight Autumn. She's our senior program director here at ABLE for workforce equity, but also has been, I would say, a mentor and a thought partner as we've given this equity a significant amount of interest and effort and innovation and investment. And I'm really excited that we recently promoted her to run our CSEP program, which is the highest barrier population we work with. And so it makes a lot of sense for someone who's really been on this journey with me and helped me through this to highlight, to have her leading that program. I want to start with just an overview of where we've been and why we've been on this journey. ABLE has always been known, I think, for innovation. I got here 9 years ago, and ABLE was already really on the forefront of coming up with innovative practices, particularly the IT Career Lab, and finding new ways for people to transition into high growth careers. And so we've always been interested in serving people who need us the most. That's always been our focus. In the fall of 2018, I was doing a lot of soul searching personally and educating myself about equity. What does that mean? I researched different frameworks and how they were used to promote equity. And I landed on the Seattle Race and Social Justice Initiative Racial Equity Toolkit. So you can literally Google those words, and I'll provide a link later on, which is really designed around the city of Seattle making decisions. So for example, they were deciding about a housing or a development on near the waterfront, and what would that mean for different groups. And a lot of times when cities are making decisions like that, it's really a cost benefit analysis, and it doesn't think about how is this going to impact different groups? And so that racial equity toolkit gave them a way to think about that kind of decision making through the framework of particularly racial equity. And so what I did is I used that framework and that toolkit and adapted it to our work. And so in 2019 and 2020, we started doing our equity strategic planning through the lens of equity using an equity framework. And so the first thing we did is talk to our constituents, talk to our customers and survey them. And so I want to share a little bit about those results. One thing I wanted to share right off is I think everyone in workforce is familiar with the racial gap. I think even at the height of the boom economy, we see unemployment rates on the south side of Chicago and other areas that have a very significant either Latino or African American population. You see those unemployment rates really significantly higher, and that's not something that's new or different, but it needs to be noted. I think what also needs to be noted is how the pandemic exacerbated that gap. It really hit people with the fewest resources the hardest. I mean, we hear this story a lot of times. The rich went off and lived in their private mansions and islands. The middle class worked from home, and the working poor either had to go to work to put money on the table and were in the front lines and put themselves and their families at risk, or they lost their jobs completely. There wasn't an option for them other than those two things. And so I think it's important to kind of get the big picture of the workforce and unemployment. This is what we learned when we surveyed our customers. The first equity survey we did in 2019, fall of 2019, obviously before the pandemic, and then we added questions in 2020 related to how the pandemic impacted people. And some of the things I want to highlight here: 25% of the people that we work with struggled to secure food. So this was October 2020. So really the hardest part of the beginning of the pandemic. 25% struggled to secure food for them and their families. 20% had housing issues. 30% had no computer at all. 20% had no reliable internet. And 20% had to help school-age children with virtual school. And this especially impacted women. So I want to pause there and just kind of give everybody a moment to kind of think about how the pandemic really hit people hard. I think that is something that we're going to have to work through for years and maybe even decades to come to really level the playing field again. So going back to our process, I'll be really honest. When we did our first equity survey in 2019, I remember meeting with Autumn after we got the results and just panicking. I don't know what to do with this information. I think it's great that we learned that we were serving a high barrier population, but I don't know what to do next. And frankly, there weren't a lot of tools about what to do next. The Seattle Racial Equity Toolkit was designed about decision points. Should we develop here or not? Should we invest in this area or not? Should we extend the transit to this place or not? But turning it into a tool for a workforce agency strategy was not something that I knew how to do. And so Autumn is one of those wonderful people that can just be like, let me think on it. Let me noodle on this. And so she did, and came back to me in late December with some thoughts about what do we do with this information? How do we analyze our barriers? And then later on, how do we execute on what we've learned? So I'm going to turn it over to Autumn, who's going to talk about that process.
All right. Excuse me. Good morning, everybody. As Bridget mentioned, as soon as I came on board, Bridget and I were talking about some of the great work she'd been doing around equity. And I just want to give credit to Bridget. She'd already been doing a lot of work, I think, on herself, as well as bringing our organization and our team and our staff in to learn more about equity and, cultural agility, and had done a lot of work around that. So I do want to give credit to Bridget, but equity is something personally for myself. I've always been interested in, obviously, race and gender. I'm a Black woman. These things have affected me, both personally and at work. And so when I came on board and heard about the great things that Bridget was doing, first of all, that's very rare that you have a CEO that is that concerned about equity. And second of all, I wanted to bring my passion and experience in these areas. You know, I do a lot of reading. I do some, like I said, some social things outside of work. So it was my pleasure to come to ABLE and kind of bring that passion that I have with me. And so some of the numbers that Bridget put up there were the result of a lot of hard work from our team. Our marketing team and Bridget pulled together, you know, many of our former and current clients, hundreds of them, and got their feedback on not just their personal demographics that they shared with us, but also their experience with our services. And so we got that information back. And as Bridget mentioned, we were kind of like, you know, what do we do with this? And I thought, if we want to make a difference, let's talk to our staff, because it's one thing to look at what's, you know, look at the numbers from our clients, but it's another thing to talk with our staff about their experiences on the ground, because ultimately, a lot of our clients' barriers are social. They're, you know, when you go into work, when you're looking for a job, a lot of that is who you are, where you live, you know, and so, and your education and your experience. And so the people that we serve, you know, they have a lot of historical barriers, just generational barriers that they have to overcome. And we need our staff to understand that. So I said, Bridget, I want to talk to the staff. I want to take this to them. They know what's happening. They know what we're seeing on the front lines. And so I went out and interviewed, I surveyed 24 of our staff, both line staff as well as managers. And I looked at the entire life cycle of workforce. So that's everything from customer outreach to enrollment, employer engagement, training. So I had about 40 questions. I put together an actual survey for our team as well. And it covered, you know, service coverage areas. So is ABLE covering the right places for our most in need? What is the look and feel of our centers? Is it a pleasant place for the folks who are coming in the door? You know, what is the quality of our service? How are our staff performing as far as how are they interacting with our clients who may not look like them? Do we seem passionate for our mission? Do we seem to really care about the people that come into our doors? And then we also looked at the diversity of the staff, how our team thought about whether our staff were diverse enough, their management was diverse. And so I got that information as sort of a primer and reviewed it. And then I brought each one of them into my office. And we had really good, like 1 to 2 hour discussions. I'm telling you, people just wanted to talk. They had lots of opinions about how we serve our clients. And frankly, people are just skeptical about surveys. So there was a lot of information that they probably wouldn't have shared with me over the survey, or they didn't. And so when I got them into my office, they were really interested in talking about what they saw or what they heard. And so the result was, you know, like half of the staff came back and said they saw significant risk in outreach and enrollment. Not that we at ABLE were creating significant risk, but just the kinds of work that we do and how we interact with our client had significant risk to creating additional barriers. And so that was a really good feedback that they gave me. And so a few things that they said, a theme that came up a lot was for one of our programs, we have this process called suitability, where we review, you know, whether or not we think our clients can make it through their training program. And a lot of that review was subjective. It wasn't concrete. It was kind of like, how do I feel about them? You know, do they seem like they have a good attitude? You know, I'm going to schedule all of these meetings and test to see if people will show up. And, you know, if we set up 5 different meetings or, you know, not outreach activities, excuse me, but, you know, like just various types of training, will they show up? Not thinking about a lot of our clients, you know, just because of segregation and poverty. Many of the barriers that they experience also make it difficult for them to show up to repeat meetings. We don't want to we don't want to create that barrier for our clients. So they said, we want you to get rid of that. They also had a lot of feedback about standardized tests. They felt like our standardized testing was not fair to our clients. It had bias for those who are heavily educated, who are used to taking standardized tests, who feel very comfortable with testing, even if they don't know all the answers. That is, I'm sorry, my notes are disappearing here. Even if they don't know all the answers, the barrier, I know many of us have experienced, test anxiety. If you have a lot of experience with taking tests, you're not going to have test anxiety. And a lot of our clients may not have a lot of, formal training. They might have but trade skills, hands-on skills that don't necessarily translate with standardized testing. Our staff also felt like they wanted to learn more outreach strategies. They wanted to have more strategies around employer engagement. They didn't necessarily feel like they were prepared to go in front of our employers and talk about the type of people we serve and get their empathy. Reentry was a huge thing. They wanted to understand more about reentry and be able to, present in front of employers, individuals who had experience maybe with arrest records or prison. Some of the feedback was, as far as like how we present at ABLE when people are coming in our doors, whether or not we wanted to have armed and uniformed security guards, or do we want to work with our partners who, are in control of those buildings? Do we want to work with them to create a less obvious presence while also making it feel secure? Because that is a deterrent for people who are just re-entering from prison. Our staff wanted to know more about trauma-informed counseling. They wanted to support our clients. They wanted to know how to deal with individuals who come out of prison with arrest records. They wanted additional space for the clients who are high barrier, who have sensitive issues that they frankly may not feel comfortable coming in, into our offices at the front desk where everybody can hear what they're saying. And so that's sort of like what we did with that overall survey. And we put together this wonderful report, and I presented in March 2020, I think March 10th, which was right before COVID. So I'll let Matt and Bridget talk about how they navigated that. But then the other part of it that I cannot speak enough about when we're talking about Bridget and all the work that she's done, she put together an equity task force. So it's a group of us, I want to say maybe 10 of us, who are essentially our CEO's advisors as far as like how we lead the organization towards a path of understanding equity. Again, so our staff can understand the barriers for our clients. And also part of that, the equity task force gives, we give advice to Bridget about what she should bring in front of the staff at our monthly staff meetings. So we always have topics at each of our staff meetings. It might be 5 minutes, it might be a 3-minute video with question and answers. It might be, just some general discussions. And so things like segregation and how that has a, historical segregation has made it so that our clients are in pockets throughout the city. How do we address gender pronouns? Because a lot of people don't, understand the importance of using the right pronouns. You might have trainers. We had outside trainers, third-party trainers who were misgendering our clients. And so these were just things that, we felt like we needed to discuss as a team, and I felt like it made us better. We also put together this amazing website for our staff with tons of resources. Thank you, Jorette. She had a big part in working with me on that. And it is beautiful. We got a lot of positive feedback from the staff. They were so excited about the kinds of information that's out there. Every month we put together a calendar. So for every day, there's a different topic that Jorette puts together. That staff who want to have a practice around learning. And we do actually have a lot of staff who are showing that they're very passionate on these topics, and they have an opportunity for every day of the month to go in and look at something new and different and learn. We have documentaries, books, articles, all kinds of things. And then Bridget sent me off to become a certified trainer for a program called IDI. It's an intercultural agility program, and I've had the opportunity a couple times to train our staff, to kind of encourage them to be more open, not just with our clients, but also within their teams, to kind of break down barriers within our teams and just create a culture of equity and inclusion and belonging within the organization, which I think translates into how we, how we serve our clients. So that's my spiel. I have lots to say. Bridget, I'll turn it over to you.
You're doing great. Let's kick it over to Matt to talk about execution.
Thanks, everyone. So back in 2020, as we started down this journey and as we were looking at obviously the data points that we had, there was obviously a little thing called COVID that happened. And, I had just happened to come into my role at that time overseeing the bulk of ABLE's programs. And, I had learned in the past from a few mentors of mine that you can never let a good emergency go to waste. That said, at the time, things were obviously overwhelming for a lot of folks. The biggest thing in our mind was how can we continue to serve individuals who need it most during this critical time, because we know that people who weren't doing great to begin with are probably now worse off because of the pandemic related closures and isolation and many other factors, including what happened to the job market. So one of the things that we were able to do is make change relatively quick on, frankly, areas that I feel as though would have taken in kind of a normal year a much longer time to sell, get buy-in. I think people were open to the idea of change in this way because of the fact that they knew that it was focused on serving participants in a positive way. And so what we could control, and we like to call it the Emergency Powers Act of 2020 internally, but what we could control really were things like how we addressed orientation, how we addressed training, and what did those things do? Giving people access to programmatic orientation to just do on the fly when they need it, I think is a really good thing. It enables individuals to access programming or learn about programming without having to physically go into a center, which we knew was impossible at the time when the AJCs had closed and other offices were closed. And so we moved these things online. And that also helped, to reduce transportation barriers, I think, for individuals who could go in or who ended up wanting to go in or having to go in later. They still could access this information online. And then we were also able to standardize it, which I think was really important. The digital divide, I think most of us on this call have heard about challenges with the digital divide when it came to the pandemic and people who were lost. And I can talk about how great online orientation is in those things, but if you don't have the tools to access that, and you don't have internet access or reliable internet access or a computer, those things can be really difficult, and especially with the closure of libraries and resource rooms. And so what we did was we obviously wanted to address this. We pooled our participants, we pooled our coaches, and we started to allocate laptops out to participants along with hotspots who we felt really needed them. This obviously was really important and helpful. So it was something that we've done it in the past and worked on programs where we allocate laptops, but never at this scale. So it was scary at first, but at the end of the day, it worked out really well. And I think, it's really important to understand that, a laptop at this point and relevant internet access, I think, is just a staple with how we find work. It's something that everybody needs across the board to be able to find a job. And so we were able to talk about that and I think address, frankly, some individuals' concerns around, well, maybe what if participants misuse the laptop, or what if they're going to do something else with it that's not related to job search? I think a lot of it is about trust at the end of the day. And that's one thing that we really wanted to instill with our participants and with our staff is that, we're trusting you with this, but we also know that the place that you are, that this is how you're most likely going to use these resources that we're providing you. So that wasn't really an issue in my eyes. The other thing was the reading and math assessments, that we revisited. I think we had been using an assessment that it placed a significant burden on staff, first off, because it was extraordinarily long. It was historically inaccurate, and then it didn't provide a very clear depiction of where someone was at when it came to actual reading and math levels. At least we figured that out throughout the course of using it for a few years. And so we switched to a shorter assessment. Obviously online proctoring was challenging when you have to deliver assessments, but we were able to figure that out as well and do things online as best we could for individuals. But I think the time, again, that it takes someone to take a longer assessment, that's really a huge barrier when it comes to programmatic entry. I don't think we should be measuring individuals on how well they're going to succeed in employment by their ability to take a 5-hour exam on reading and math questions that they probably haven't heard since they were in high school or elementary school. So we wanted to make that barrier as low as possible, while at the same point understanding that, yeah, you know what, this can be a good barometer in some instances, and a good indicator of whether or not someone does need a referral for adult ed and adult literacy services, but we were able to come about it a different way and a more efficient way. The other thing that we looked at was all of our customer facing documents. And I think, these documents needed to have another look. I think it was really eye opening for me, at least, to view these things through kind of the eyes of a job seeker and what they experienced, especially during the pandemic when a lot of the stuff was online and they had to navigate these things online. As we transitioned to using things like digital signatures and accepting those from individuals, that gave us really a window of time to start to create a lot of documents differently and to re-examine that. And look, the reality is, we were putting barriers in our own way when it came to things that we were asking for. Why do I have to know the answers to all of these questions when in reality, I can find that out by talking with you later on in the process? Right? It shouldn't be an inhibiting factor to whether or not you gain access to programming to begin with. And so that's the lens that we really took our document modification through. And it worked out for the best in my eyes. I was able to delete paperwork. And anytime you can get rid of paperwork that isn't required, I'm thinking that's a win. And I think everyone on this call would agree. Implementation of online signatures and digital documents retention. I talked about that. And then, probably one of the most important ones on this slide is the increased focus on customer outreach and recruitment. Historically, I feel as though, and I've been doing this for a while, and I know many people on this call have a lot of experience with this as well within various workforce systems. In my experience, the workforce systems that we have been reliant upon individuals walking into a center to receive services. And there's been a lot of reasons for that, and there's a lot of historical reasons for that. However, I think the pandemic has changed that, and we noticed this trend even prior to the pandemic. And so one of the things that we really worked to prioritize, especially during the early phases of the pandemic, was making sure that customer outreach component was solid and that we were reaching out to people in the communities where they were. Outreach strategies, we've always had an outreach strategy, but I think we really adapted it to what we're seeing today, back even in 2020, in that we were able to target job seekers and just make sure that they knew about how the system could help them. That is a critically important piece of any workforce conversation with a job seeker is, what can I do for you? And I feel as though, as we were going through this laundry list of things that we had to change, that was one thing that I think was missing. And instead, the conversation was flipped. And it said, what can you, job seeker, do for me as a program? When in fact, it needs to be the opposite. Our programs are here to serve the job seekers. And so I think taking that, looking at it through a very different lens, making the adjustments that we needed to when it came to outreach, to know that, we may never see the traffic that we saw come into our centers ever again. So we need to be ready to go out and to meet people where they're at. We've started to see some really good traction. And I will say, we're able to continue to enroll people in our program from high need communities and high need areas, despite the early challenges, both bureaucratically, systems wise, that the pandemic presented to us. The last part on this slide is obviously, we worked to record orientations, learning management systems. We invested in an applicant tracking system to match job seekers faster to jobs. We felt that business services and frankly, other efforts that our programs were engaged in were shared across many programs. And I don't think that Able's in a unique position with that. I think a lot of agencies have that, where you have multiple programs with similar requirements. And so let's find some efficiencies. And we were able to bring a lot of things and centralize them, including things like eligibility, training. We invested in a learning management system and brought that in, as well as business services. And we found that by centralizing these things, it not only helped with efficiencies like I talked about, but it really reduced the kind of natural silage, I like to call. I grew up on a dairy farm, so I use farming terms a lot and analogies, but it reduced that kind of natural silage that programs tend to have between one another. And that was really important for us, I think, to ensure that everybody's needs are getting met. Next slide, please. Cool. So we talked about what we could control, right? But there were things that obviously throughout the course of our work, we couldn't. And when we started to see those things that we couldn't control, and they were identified throughout a lot of the survey work and other things that we were doing, we decided that we had to hire a consultant to identify those. And, the consultant worked to really figure out where the barriers existed. There were still things that we were doing that maybe we were just blind to internally that could potentially impact job seekers, staff in a negative way. But what other things were there? Is it legislative? Is it a kind of unwritten rule? Is it something that is at a state level, a local level, a federal level? And so we wanted to figure that out. So like I said, we brought a consultant in, and they created a list and did some deep dive into legislation, into different rules and policies. And they were able to really create a list for us that identified those areas. And that then took on a life of its own and became the areas where we really wanted to push on advocacy and see change. And so that led then to conversations with local, state, and federal leadership about what could be changed and adapted. I will say we've had a lot of these conversations, and with a lot of workforce leaders that we've met with, 99% of them agree with the same things. And I think a lot of people get stuck as to how can we change this? A lot of these things feel overwhelming. And they did to me at first too. And, a lot of these things could still be overwhelming to us, but I think talking about them is definitely the first step. And that's what we found has been really effective when it comes to meeting with, various legislators and even their assistant staff, is talking through these things. A lot of times folks don't even know that, this isn't in the spirit of the legislation, right? So they assume it's one thing when in fact it leads to another. And so that's how we were able to position, a lot of these things. And just going down the identified kind of policy list change things that we've been focusing on. Autumn talked about the term we owe as suitability. I think that this term in itself, it's obviously been used for a very long time within multiple workforce programs. But in my opinion, at least, this implies that someone needs to almost earn their way into the program. Like I said, it's that reverse. What can you do for me to gain access to my program and help my metrics? And that's just it's not the direction we want to go. And it's not in the best interest of the job seeker. And so we eliminated that term. And I think that that's been really helpful. It's a small vernacular change at the end of the day, but it's one which I think helps our coach mindsets change and staff mindsets change, and really move towards more of a strengths-based approach, and understanding that we need to meet participants where they are. Everyone comes to us with skills. And, our job isn't to put barriers in their way, but instead meet them where they added, to help them move forward from there, to manage those barriers and help them get to work. Paperwork burden, I think, if you're on this call, you're familiar with a paperwork burden. Oftentimes a lot of programs tend to have these overwhelming paperwork requirements, both on the participant end and the staff end. And the challenge that this creates, which again, I know we're all familiar with, but you end up having a program focused so heavily on compliance that direct service and participant means take a back seat. And that's a really dangerous place to be, because now you're not having the stated impact that you really need to on participants. And instead, you're reverting back to this focus of how can you help me achieve my metrics? And that, again, not a place that we want to be. So we really took a look at that paperwork burden internally, and now we're working on the external facing conversations with that. I think look back periods across the board tend to be inconsistent. at least from state to state, and even areas to areas for program eligibility. And so that's something where I think there needs to be a lot of flexibility around to capture individuals and to ensure that we're allowing for individuals to gain access to programming. And not putting artificial constraints on these things, but instead opening it up. I think is really, really important to define those things. And then, we talked about barriers. I think that's been a running theme here, right? The digital divide, barriers to employment, including, Wi-Fi access, home internet, laptops. It still remains a challenge in that some grants and programs won't pay for these things. And they won't allow us to use our supportive services funding in a way that is going to really hit home and help a participant with the one thing they need most, which is internet access and a laptop to find work. And so I think changing that mindset a little bit, again, to more of a trust mindset when it comes to allocating these resources to participants is critical. Benefits cliff. I'm not going to talk all day about this, but we know that this is a challenge. I think specifically I look at the SNAP populations that we serve, individuals who are in SNAP programming, and how, the minute they get a job, that's it. I'm off of SNAP. There is no off ramp for benefits. It's instead a literal cliff that they fall down. I envision, and I think a lot of people share this vision with me, a ski hill approach, ramping down benefits in a coordinated way, in a way that's supportive, and in a way that doesn't set up individuals for failure, especially when they're going through such rapid change, something like getting a new job. We want to make sure that they're financially stable. Performance measures. The way program performance is tracked, and notably, I call out our WEOA funding. A lot of times it's set up to incentivize and favor programs to serve lower barrier populations, who on paper at least have a higher likelihood of obtaining employment. And I think that there's been some changes to this over the past few years. In fact, I know that there has, but the practices, I think, still remain prevalent. It's not easy to change that and to move the ship quickly. And so I think we need to continue to have conversations around not incentivizing that type of enrollment behavior, and ensuring that we are able to serve everybody who walks in the door. And then you look down too to things like and this goes hand in hand, right? The statistical adjustment model, again, which is a WEOA specific thing. And on paper, it looks good. I think, though, it becomes really challenging to administrators of programs because you don't know where you are in real time. And that's incredibly hard to manage too. It's incredibly hard to, I think, even see where you're going to be. And so that in itself really ties into the previous bullet point around performance measures and disincentives. And so, this is an area where I do think a lot more conversation is warranted. And again, these are things that I'm really happy we have so many people on this call. As we start to advocate for things and as we start to talk to leadership, I think feedback from this group is critical. Your support in this is really important as well. So with that, I'm going to kick it over to Bridget.
Thanks, Matt. I do know we have a few non-WEOA people, and you'll see, even though we work in a lot of different programs, we found the most barriers in WEOA. And so a lot of our work you'll see is WEOA focused, and you'll see a lot of acronyms and terms that you may not be familiar with. So for example, the look back period. So if you're a dislocated worker in WEOA, it's the period of time that sort of triggers that eligibility for dislocated. So if you got laid off within a year, within 6 months, those periods are determined by different policymakers. And so we want that to be as broad as possible. And the pandemic is a perfect example. You may have somebody that was laid off in March 2020, thought they were going to go back to work when the rates came down, maybe went back to work for a couple of months, lost their job, were furloughed again or lost their job again. And so by the time they navigate services and think, geez, this is going really poorly, I'm going to have to go find another job in a whole other industry, it may be a year or two before they even navigate services to get that help. And so if you have a short dislocated look back period, that person's not eligible for the program. And so that's an example. And the statistical adjustment model. So this is where, your performance measures go through a statistical adjustment so that if you are serving a higher barrier population, you basically get credit for that. but it's later in the process. And so it's good. It's a step in the right direction. However, there's sort of attitude adjustment and culture adjustments and process adjustments that need to be, that you need to focus on to make sure that people understand what that is, particularly workforce boards that maybe aren't in the policy world, and maybe need some education on this is how the adjustment model is going to work, and how, that's what we really need to look at, is that sort of lagging indicator of how we did. And so that's just a couple of clarifying points before I kind of wrap this up. Matt and Autumn both talked about the importance of talking to staff, and I think I cannot. And I think somebody in the chat also said, here's the thing about the work. When you talk to your frontline staff and you talk to your customers, they know this stuff. They see this every day. And they have the frustration of wanting to serve people with higher barriers and seeing those barriers every day. And so talking to your employers, your job seekers, your frontline staff is absolutely the very first step. And then figuring out what are the things that like what are those things that I control. I think one of the things that was really kind of eye-opening to us was not out of maliciousness, but out of just this is the way we do things, or this is the way we've always done things, or hey, I need to create obstacles for people to get over so that I can see if they're suitable. None of that was done out of maliciousness, but it was done by not having an equity framework in place that would allow us to think about these things from an equity lens. And so as a result, a lot of stuff over the course of 40 years just sort of cropped up. Let's have a workshop that people have to go to, travel down, go to the one stop, physically be there. I don't care if you have transportation, mobility, or childcare issues, you're going to have to show up so that I can see if you're suitable. None of that was malicious, but it is stuff that crops up, and you will find when you do your own analysis that those things are happening without even realizing it. So I want to share with you, because we made mistakes as we went through this. We're nowhere near being done. And I hope that you can learn from our mistakes. Our journey is not your journey. I have no idea what additional barriers you might find, for example, running a rural AJC, or working with youth, or working with refugees. So I'm hoping that you can apply some of what we've done to your own journey. You'll see there's a link here. I'll make sure you get it. This is our DEI by day. I keep coming back, and Autumn mentioned culture and attitude, and making sure that your team has the tools to be cross-culturally agile so that they can help you identify when those barriers come up. And then the last thing I want to share is, this is also a perfect moment for advocacy. We have our understand that WEOA reauthorization is starting now. WEOA, in our estimation, is the hub of the workforce system, but it's also the program that has the most barriers to equity. And so advocating around changes needed to make WEOA more equitable is perfect timing for that. Figuring out how do we navigate or improve the SNAP benefits cliff. The state has a wonderful workforce equity task force that's done some really great work over the last couple of years, making sure that we're implementing those changes. And, other ideas, like I said at the beginning, we're on this journey. We're nowhere near done. We've made mistakes. We've learned from our mistakes. We've dealt with turnover as a result of making a lot of changes. And that change is hard. And so these are things that I'm hoping we can create an environment where we can all share ideas, share discussion about things that you've tried, and make, your own mistakes, your own successes, so that we can all learn from this, because it's not an easy thing to go through, but it is a necessary thing. So with that, I'm going to pause and answer any questions or any discussion that you all have. If you have your own thoughts around your equity journey, please feel free to put them either in the chat, or you can unmute yourself and ask the question.
I have one question here in the chat, Bridget.
Go for it.
What, if any, barriers have been identified with mature job seekers engaging in WEOA services and being successful?
Yeah, that's a a real challenge for CSEP. What's interesting is we provide CSEP and WIOA services. And so I see that all the time of CSEP participants wanting to be co-enrolled in WIOA for some other types of service and not being deemed suitable in WIOA. It's a challenge. But I also understand where it comes from, right? So if somebody has a 4-year durational limit in CSEP, that's going to hurt the performance of WIOA. And so that's when we talk about advocating for changes to how performance, the statistical adjustment method, and how performance is done for WIOA. That will help reduce those barriers for older workers to get the support that they need from WIOA. So you're absolutely right. That's why we mentioned that. I'm seeing a lot of good thoughts here. Barrier to helping Tanf and SNAP customers is the cliff. And AJCs are not incentivized to help people that are going to take a long time to get employed. Absolutely right. That's the same with SNAP, TANF, CSEP. Anybody that has more barriers is going to take some time. Maybe they have to go back and get a GED. Maybe they have a lot of barriers and need to work on paid work experience for a while. Absolutely, they're not incentivized to help customers that need the most help. How many Illinois job seekers were surveyed? I have to look back on that. So this survey was across all of our programs, which would be Nebraska, Iowa, Illinois, Indiana, Minnesota. So I'll have to look back on how many were in Illinois because it was also across different programs. So I'll have to get back to you on that. Our local office was told they do not cover tuition if they're online. Interesting. They will not cover expenses if the college is out of state. Very interesting. That's definitely something we should probably advocate about. Oh, and Steve just clarified. So that depends on the occupation and the provider. That's a good point. Thank you, Steve, for clarifying that. Other questions or experiences? Yeah, sorry, go ahead, Jarrett.
Another question I have here in the chat from Sarah. I think this is probably more of like an Autumn question, but she would like to know more about how the data was gathered for the surveys, what states were included, all locations in the state, etc. Anyone can take that. I
actually think I have that information.
Cool.
So so the way the survey worked is we first conduct an online survey, and we used a randomized sampling of all of the job seekers in various programs. So that includes trade, SNAP, veterans, WIOA, CSEP, I'm probably forgetting one, across multiple states. So our WIOA program is in Nebraska and Illinois. Our CSEP program is across all of those states. Our IT Career Lab program is in Minnesota and Illinois. So you're asking for a lot of detail. After the online survey was done, our call center conducted phone calls with, so we could get a proportional number of people that maybe didn't have internet access to do the online survey. And so that's where all those results come from.
Thank you.
And so again, this is our data. It'll be different for yours. And we don't pretend that the thousands of job seekers we surveyed across the Midwest is indicative of what everyone else will see, but I think it's, the trend is probably similar. Other questions, or anyone have thoughts or experiences that they want to share as well around this issue? Going once?
So Bridget, I'm curious, has anyone done any work? Has anyone done any work they'd like to share with us? It's probably another way of.
This is Jennifer Serino from Lake County Workforce Development. One thing that our workforce board touts as a huge success is we brought in a training program for our workforce board members. We hired a trainer to do four series, 2 sessions each series over a 9-month time frame to engage our board members, to bring awareness to our board members. So when they are reviewing policy, they're doing it through kind of the same equity lens. So our board members were very clear to us early on that they're not educated in this space. They can't be making these decisions on policies unless they had a new baseline to be working from.
That's brilliant, Jennifer. Would you mind shooting me an email with the trainer contact information, and we'll make sure we share that when we share the presentation?
I will
Thank
do
you.
that.
That's a great idea. That is, and particularly with, I mean, this is really wonky stuff when you get into the details. And if, you know, the statistical adjustment method analysis by itself is hard to explain, particularly for somebody that's volunteering their time on a board and not doing it, you know, 40 hours a week. So that's a really fantastic suggestion. All right. Any other questions or comments? Well, thank you all for joining us here on a Thursday morning. I really appreciate it. I think just even having so many people interested in talking about this topic means that we're all on the right path, because once you start thinking about it, you'll start seeing things that you didn't even realize were barriers until you start talking to your frontline staff and customers and realizing, you know, what a challenge it is for somebody to schlep down to the center if they have transportation, childcare, mobility issues, or 10,000 other things. And once you start thinking about those things, you'll see them everywhere. And I think together we can really make a workforce system that can come out of this pandemic and really help the people that need it the most. And I'm excited that so many people jumped in. I'm excited to learn from you. I'm excited to work with you on making our workforce system across the country work better for the people that need it the most. So thank you everyone for coming. Thank you to Autumn and Matt and Jorette for making this possible today and for all of your work to help us on our journey. Have a good day, everyone. Bye-bye.